Let's first see more about heparin. Heparin is a naturally occurring anticoagulant which is produced by the basophils and mast cells to prevent formation and extension of blood clots. It does not disintegrate the clots that have already formed. It permits the body's natural clot lysis mechanisms, that is called fibrinolysis, to work normally to break down the previously formed clots. It works by activating the antithrombin 3, which blocks the thrombin from clotting the blood. Now, let us see the mechanism of action of heparin in details. Heparin forms a complex with antithrombin 3 complex. This complex interacts with factor 10A and that results in inactivation of factor 10A. The thrombin reacts with heparin antithrombin 3 complex and it results in inactivation of thrombin. Thrombin is required for conversion of fibrinogen into fibrin. So if the thrombin gets inactivated, the conversion of fibrinogen into fibrin will not occur, and when there is no fibrin formation, naturally the coagulation process will stop. There will not be any clot formation. The above complex also inactivates, that is the heparin antithrombin 3 complex. It also inactivates the factors 9A, 12A and 13A. So due to inhibition of factor 13A, formation of fibrin clot is again inhibited. So we may say that heparin has got a dual mechanism. Administered by intravenous or subcutaneous routes because it's a polysaccharide which undergoes degradation by the gastric acid. It is never to be administered by intramuscular route because of risk of hematoma. The prominent side effect of heparin is alopecia, and the uses of heparin are varied, like post-operative patients, acute infections, pulmonary embolism, venous thrombosis. It does not cross the blood-brain barrier. Therefore, it is safe to use in pregnancy. The antidote for heparin therapy is the intravenous administration of basic protamine sulfate, which has affinity for the acidic heparin.